everyone, and thank you all for being here today. My name is London Breed. I'm the mayor of San Francisco, and I'm joined today by President of the Board of Supervisors, Norman Yee, as well as the Director of the Department of Public Health, Dr. Grant Colfax. We are also joined by Police Chief Bill Scott, the Director of the Department of Emergency Management, Mary Ellen Carroll. Thank you again to the press for accommodating this virtual press conference in order to maintain social distancing during this very challenging time. I also want to take the opportunity to thank the people of San Francisco. This weekend, things looked like somewhat of a success in terms of social distancing for the most part. Definitely an improvement from last weekend. The streets were pretty clear. There were some definite hotspot areas that we're going to be focusing on, but the beaches and some of the parks and other places where people were practicing social distancing, and we very much appreciate your cooperation. It will make a world of difference, and in fact, we already have made a difference in really saving lives. We may not realize the impacts of this until this is all over, but eventually we will learn, I'm sure, that because of what we have done and how we all have participated in complying with social distancing, it truly has saved lives. As of today, we have 374 confirmed cases with 6 deaths. That is 6 people who have passed away because of the coronavirus, and my heart goes out to the family members and the friends of those who we have lost here in San Francisco. One person is too much of a loss, and as we have said before, this is a very deadly virus, as you are seeing, not just in San Francisco, but throughout the country. And the reason why we have taken significant steps has everything to do with saving lives and protecting public health, because we know that there will be challenges on our healthcare system. And we know that people are anxious to know about the stay-at-home order and whether or not that will be extended. I know that our county health officers will be making an announcement tomorrow to talk about the specifics of extending the stay-at-home order until May 1st of this year. And more details are to come on that, but for the sake of planning and so that everyone can begin to know that this is going to continue to have an impact, you should definitely plan to stay at home, and this process and what we're doing here will continue until at least May 1st. If anything changes, we will definitely notify the public. So I want to just talk a little bit about some of the challenges that we are having and will continue to have, and what we're doing to prepare for those challenges. We've said from the very beginning, we knew that our vulnerable populations, not only consisting of our elderly, but also those who are living in congregate settings, and sadly those who are living on our streets would also be considered a part of that vulnerable population. And so we would have to move quickly to make sure that in places where we have single room occupancy hotels, where our shelter systems are, and places like Laguna Honda, which house a significant population of elderly patients, we had a plan and we were going to keep people safe. From the very beginning, we knew this would be a challenge. And many of you have heard about some of the recent information of staff members being tested and coming back positive in Laguna Honda. And since then, we've been taking a number of steps in order to test others who might have been in contact with those individuals. And thus far, what we have learned is 9 employees of Laguna Honda Hospital have tested positive, as well as 2 patients. And we are still testing people at Laguna Honda Hospital, and we'll have more information about the specifics once those test results come in, and Dr. Colfax will provide some more details as well. We knew the situation would be challenging, and so immediately last week, I sent a letter to the Federal Department of Human Services asking for significant support so that we could not only focus on making sure we provide the resources and support to this hospital and we don't continue to drain other services, but we have the expertise and the testing on site and the other things that are needed in order to prevent something from happening that we know has happened in other places throughout the country, including in Washington, that house a significant population of elderly patients. Laguna Honda is one of the largest hospitals of its kind anywhere in the country, housing over 750 very, very vulnerable residents who cannot take care of themselves. And this is basically their home, and this is where they eat, this is where they live, this is where they're cared for. And so we have been taking immediate steps in order to help support this hospital and support the people and the staff who are a part of it. We were fortunate in that the CDC on Friday, after sending that urgent request to the U.S. Department of Health and Human Services, the CDC has sent us 2 infectious disease doctors and 2 epidemiologists. And the California Department of Public Health has sent 2 infectious prevention nurses to help assess the situation at Laguna Honda and to make recommendations. And we also have a dedicated staff member at the CDC in Atlanta to help monitor and facilitate the situation, specifically at Laguna Honda, because we know that, again, this is a very vulnerable population. More testing needs to be done. And it's going to be important that we have the resources and we have the support necessary to protect and save lives. This is just a start, and I am grateful for what we've received, but I want to be clear, it's not nearly enough to get us to a better place with specifically concentrating on Laguna Honda Hospital. So we are definitely going to be reaching out to our federal and state partners to ask for additional support for the residents and the staff at Laguna Honda Hospital. I also want to be clear that the situation will escalate at Laguna Honda. It will escalate here in San Francisco. And the fact that we are taking such drastic steps to, in essence, pretty much shut down San Francisco has everything to do with how serious this is. I can't reiterate enough how important it is for all of us to continue to comply, for all of us to continue to be good citizens, to continue to cooperate. This weekend, I received a note from one of my neighbors. The note basically had the email address and the phone number of one of my neighbors on the block who said they were the block captain. So if I needed anything, whether it's grocery shopping or pharmacy pickups or what have you, or even someone to talk to, they were available. And I got really emotional when I received that note because it just made me think about how amazing people are in this city and how I've heard of so many stories about people reaching out to their neighbors, people identifying elderly people that they know need help and just dropping off groceries, folks just really stepping up and being there for one another. Because we know that it's not just about the physical health and what we need to do to combat the coronavirus. We also understand that as human beings, there's an emotional toll that this will take on so many of us. So it's so important that we continue to uplift one another and be there for one another as much as we possibly can. My thoughts and prayers definitely go out to the team at Laguna Honda. For 14 years, that team took care of my grandmother who had dementia. And I want to thank them for all they continue to do to give dignity to so many elderly patients who may not have family visits, who may not have support and resources to do anything other than to just be there. And those nurses and those doctors and those social workers continue to put a smile on the face of those patients. They show up every day. And they just really deserve our respect, our support, and we will do everything we can to continue to do just that. So at this time, I would like to introduce Dr. Grant Colfax, who's going to provide us with a lot more detail about specifically what's happening at Laguna Honda, what we are doing to prepare for the inevitable, and how together we will do everything we can to save and change lives and get through this. So thank you all so much. And let me wipe this mic down. All right.
Good afternoon. I am Dr. Grant Colfax, Director of Health. Thank you, Mayor Breed. Today, I am saddened to report to the San Francisco community that Laguna Honda Hospital has a growing outbreak of coronavirus. We've prepared for this since the very start of our city's response to the pandemic, and we will continue to do everything we can to protect Laguna Honda's residents and staff. I want the Laguna Honda community and all of the families to know how much I care, we care about them, and they are our top priority. We are intensely focused on doing everything we can to protect everyone at Laguna Honda from harm. But I also need to be realistic and forthright. As we look at the data and the patterns around the world and in our country, we know that long-term care facilities are at most risk for coronavirus outbreaks. Therefore, we expect the situation to unfortunately get worse. Across the United States, many long-term care facilities have been hit hard by the coronavirus, including in California, Washington, Colorado, Minnesota, New York, and many other states. No local community is equipped to manage this escalating crisis alone. That is why we have asked for help from the state and federal government, and I am thankful that some of our requests are starting to be answered. As of today, infection control nurses from the California Department of Public Health and infectious disease physicians and epidemiologists from the Federal Centers for Disease Control and Prevention, the CDC, are on Laguna Honda's campus. Along with state and federal teams assisting from off-site, these experts are assessing the situation and will make recommendations for ongoing management of an outbreak that is expected to escalate. They will also work with leaders at the Department of Public Health to develop a prospective outbreak prevention and response plan for long-term care facilities in addition to Laguna Honda in San Francisco. I am grateful for this help, and we need more. From the beginning of the global outbreak, efforts by the city of San Francisco to prepare for the coronavirus have prioritized the most vulnerable populations: residents who are over 60 years old and those with certain underlying health conditions and chronic diseases. The residents of Laguna Honda Hospital are in the most vulnerable of these groups. Laguna Honda currently has a total of 11 confirmed cases of coronavirus. 9 are among staff and 2 are among residents. All are in good condition. Since March 26, 158 staff and 54 residents were tested for the virus. Among residents, 2 have tested positive, 51 negative, and 1 result is still pending. Among staff, 156 have tested negative, and 25 more tests are underway. I expect more cases of coronavirus in the Laguna Honda community among both staff and residents, because it is now spreading throughout the Bay Area. We are drawing on all the resources we can muster at the local, state, and federal level to strengthen our response. Laguna Honda has been and remains a top priority in the city's preparation and response to coronavirus. The first health officer order, after declaring a local health emergency in early March, was to restrict visitors from Laguna Honda in order to protect the institution's residents. Laguna Honda leadership has worked actively and diligently to train staff on coronavirus procedures, including the use of personal protective equipment, PPE, thorough cleaning of common spaces and resident rooms, and other prevention techniques. Here's what is happening on campus right now to respond to the outbreak. First, the hospital incident command system is activated to manage the crisis, and the incident commander, Troy Williams, is here to answer further details about that process. The state infection control nurses are creating expanded protocols on environmental cleaning, PPE, and staff safety. The CDC is intensifying the contact investigation to look for sources of infection and the pathway of spread. This will inform our current actions and further development of an outbreak prevention and response plan that takes the coronavirus situation fully into account. The 2 units where the cases have been diagnosed, South 4 and South 5, are under an extensive quarantine order. Each of these units houses approximately 60 residents. Within these units, doors have been secured. Sheriffs are at the doors, preventing residents from leaving and only allowing appropriate staff to enter. Residents are being assessed for symptoms on every shift, and staff are being screened twice for symptoms at every shift. Testing of all staff on South 4 and South 5, where staff cases have been found, is almost complete. To date, 9 positive cases have been confirmed. Testing of all patients on South 5, where patient cases have been found, is complete and results are pending. To date, 2 positive cases have been confirmed. All non-essential personnel are restricted from entering the facility. All essential visitors, staff, and residents are medically screened. All Laguna Honda staff are screened at the start of each shift. In addition, Laguna Honda is setting up a field care clinic on its grounds as a precaution in case there is a need to separate groups of patients. We are continuing to assess the situation and adapt our response accordingly, working with our state and federal partners. However, even best efforts are no guarantee against the spread of the virus. There are currently 374 cases and 6 deaths due to coronavirus in San Francisco. In addition to our focused rapid response efforts at Laguna Honda Hospital, the city is preparing its hospital and health systems for the expected surge of hospital patients. I remind all San Franciscans to do your part in slowing down the virus. By decreasing community spread, you will help protect vulnerable groups, like the very residents of Laguna Honda, other long-term care facility residents across the city, other elderly people, and those with underlying health conditions and chronic illness. This is time to come together as a community while we stay home whenever possible. I cannot stress that enough. Unfortunately, we will be seeing more cases and deaths in the coming days and weeks. Please do your part to keep those numbers as low as possible. Thank you. And I would like to introduce President Yee, Board of Supervisors.
Good morning. I'm Norman Yee, President of the Board of Supervisors, and I also am the supervisor for District 7, in which Laguna Honda Hospital is located. First of all, I want to really thank the leadership of Dr. Koufax and also Mayor Bree in taking a very early aggressive stand with these vulnerable population that we're dealing with. We knew that at some point somebody was going to be infected. So as tough as it's been to say no visitors coming to Laguna Honda is something we had to do. Think about it. The people that are there in the hospital are now not with their families, not with their friends visiting. And the love that the family and the friends want to provide for them, they can't. So a tough decision. It was very difficult to make, but I think that was the right decision. It probably, in fact, delayed any infection there. It probably, in fact, reduced the numbers that we're seeing today. What I'm saying is probably reiterating what Dr. Koufax was saying, that we need to take an aggressive stance. We need to attack this aggressively and do everything we can to slow it down, to minimize how many people are going to be infected, whether it's staff or the seniors themselves. The one thing that we could do even more aggressively if we have the tools is actually start testing everybody there. Everybody. We can't be working in a vacuum. We can't be guessing, oh, where's the next person that's going to be positive? We have to get ahead of that. So as Dr. Koufax and Mayor Bree were saying, we're reaching out to the state, we're reaching out to the federal government. Please respond because we need your help. That's all I have to say today. And thank you for, as the two of them had mentioned already, thank you very much to the residents who are behaving the right way, social distancing. Stay at home as much as you can and enjoy whatever you can at home. And if you have to go out, make sure you stay away from people, at least 6 feet, and to continue washing your hands. Thank you very much.
All right, we'll open it up to some questions.
Madam Mayor, this is a question from Luz Pena of ABC 7. What is the city doing to help small businesses during this crisis?
So one of the first things that we announced early on, because we knew there would be some real challenges with our small business community, is a fund to provide $1 million in grants right away. That money has, of course, quickly dried up, and we also provided a delay in business taxes until 2021, so that businesses here can hold off on paying their taxes until next year. We put a delay on a number of fees that businesses get charged, and we also provided a $10 million fund for employees where you have businesses who have sick leave, and for example, if an employee only has 2 weeks of sick leave, we could provide an additional week of sick leave through a fund that is available, and we've tried to make sure that we provided all these options to small businesses. They can check out the website oewd.com for more information on how they can get additional assistance. The governor added additional There are others who actually before did not qualify for unemployment insurance that now qualify for unemployment insurance. And so state unemployment insurance is available to a lot more people than it ever has before. So it's important that people at least apply because in all likelihood you may not think you're qualified, but you are. I also am working to develop a no-interest loan fund, which through Give to SF, where we've partnered with a number of nonprofit agencies folks in the private sector to contribute money along with public dollars. We're hoping to make that fund available to businesses sooner rather than later. We understand that businesses are suffering and there's some real challenges with paying bills, but I think that our commercial moratorium on evictions and a number of other things that we are doing to just really slow down or hold off on extreme responses to the lack of our business community and their inability to pay bills because of the resources that they're no longer able to generate. I think that some of the measures that we put in place will be helpful. I know that they won't be enough, so we're going to continue to add a number of resources to help support our small business community. And I just want to be clear, there's a lot of folks who are hurting out there, and we're going to do everything we can. But this is a problem that doesn't just exist in San Francisco. It's all over the country. It's all over the world. And it is going to be difficult to help every single person, but we are going to do our very best.
Question from Sing Tao Daily. As we know, the construction business is classified as essential under the shelter-in-place order. For affordable housing building, this is understandable. What about luxury home building?
So the fact is, in San Francisco in particular, where the cost of building anything is so expensive, the fact that we don't build is a problem. So it doesn't matter what sort of housing gets built. The fact is, when this is all over, people are going to need places to live. So I'm not going to pick between one housing versus another. Housing is essential, period. And what we don't want to happen is what happened, especially when we started to focus on job opportunities between 2010 and 2015, during the time when we were attracting a number of tech companies and other businesses to San Francisco. For every 8 jobs we created only 1 unit of housing. And you had people lining up in the Western Addition community where I grew up, where you would never see anything like this, for 1 apartment, which I think drives up prices. So the fact is, all housing is essential, and we don't need to pick one over the other. The fact is, when this is all over, I mean, just think about it. We have thousands of people on the streets. You think we're going to be able to build thousands of affordable housing units to house them? This is going to require every single unit that we can get on the market, no matter what kind of unit it is.
Thank you, Madam Mayor. The next questions are for Dr. Colfax. This question is from Reed Albergati of the Washington Post. There's a question and a follow-up. What data are you using to make your public policy decisions, and what are you missing? And I'll read the follow-up for you. What's your view of using modeling to predict what will happen with the virus, and are you relying on any models?
So thank you. So the first question, in terms of what data are we using to plan our response, we have some of the very best people in the health department at UCSF, University of California, San Francisco, and UC Berkeley, helping us pull in data from all sorts of sources, both locally, nationally, and internationally, to make an informed response. Some of the key things that we're looking at, obviously, are the number of cases, very importantly, the number of people who are hospitalized, and including the number of people in the intensive care unit. following those numbers very carefully and using other data from China, Italy, and now New York to estimate what we need to be prepared for in worst case scenarios, and also on a daily basis, updating those numbers to see where we stand. So in terms of what we're missing, you know that there's clear testing deficiencies across the country, and we are working to expand our testing capacity in San Francisco. We still do not have an accurate prevalence number. So in other words, we do not know overall per 1,000 people in San Francisco what the rate of the virus infection is. And we are working again with our UC Berkeley and UCSF colleagues to determine that number from a number of data sources as quickly as possible to get those estimates. Those will be very important in informing our models. With regard to whether models are helpful, yes, I think that they are very helpful. They provide a number of plausible scenarios. They certainly do not provide certainty about where we're headed, but they provide plausible scenarios to help us plan our response going forward.
The next question is from Jamie Haar of the Associated Press. The Department of Public Health is sending health inspectors to conduct inspections at SROs. How many are you checking, and what are you looking for or not looking for?
So we have scores of SROs across the city. We are focusing on a number of things, but particularly with regard to hygiene, making sure that proper cleaning procedures are being followed, making sure that we're doing outreach and education to the community around the social distancing order, making sure people have the information they need, and also making sure that people have the information they need in the event that they need care. They know who to call, where to call, when to call, and to get the help they need, both from the public health department, their community, and other healthcare providers and systems across the city.
And Ms. Hart's follow-up, if there are unsafe conditions, what will you do? Will you move people out?
So we are focusing on ensuring that the conditions that people are living with are as safe as possible, and ensuring that if people have symptoms, that they are tested, if they are positive, that they are provided with resources and physical spaces that allows them to self-quarantine from their community and other people that they may come into close contact with.
The next question is from Shannon Lim of KQED. There's a question and a follow-up. What are San Francisco's plans to start testing homeless people for the coronavirus? Do they have a protocol for who they will be testing and when this will begin?
Yes, so I appreciate the question. So I've emphasized that we are expanding our testing. It's a key priority of the department. I just want to be really transparent, though, about what we're dealing with. And just to give you an example, when we sent our request up to the state with regard to asking for more help in responding to the Laguna Honda situation, part of that request was the request for more swabs, testing swabs. This is not just limited to San Francisco. This is a national shortage. We are struggling to get swabs in order to test. So along the supply chain for testing, there are severe limitations. While we are working to expand testing capacity, my public health lab is expected to triple its potential capacity starting today. We are still struggling along that supply chain to ramp up testing as quickly as possible. So anything from the specimen collection that you need for swabs, from the processing reagents that are needed, our supply chains are episodic and hard to determine. So with regard to testing people who are experiencing homelessness, we will again focus on people who are symptomatic, people who have had high-risk exposures.
Excuse me. Ms. Lim's follow-up is similar to a question from Dan Simon from CNN, so I'll read his. The medical director of the ER at UCSF believes there is a flattening of the curve and credits the stay-at-home order. They're not seeing a surge of expected COVID-19 patients. Do you believe this is the case, and are you cautiously optimistic this is so?
I haven't spoken to the ER director directly. I think it's still too early to tell. We are monitoring the numbers. The thing is that when this disease takes off, if it does take off, it takes off very rapidly in communities, just like we saw in New York. The escalation, the curve the curve is very upsloping very quickly. It's what we call a logarithmic increase. So we need people to stay at home. We are expanding the stay-in-home order. More details will follow tomorrow. But we need everyone to do their part. We are watching the data very carefully. I simply do not know if our aggressive actions early on, Mayor Breed's aggressive actions early on, have had the intended effect. I certainly am hoping and praying that that is the case. We still need the data to confirm that.
Ron Lim, LA Times, says a similar question, asking to clarify how many people with the virus are hospitalized in San Francisco right now, and also the shelter in place in terms of flattening the curve. If that's not happening now, when do you think we might see that happening?
So to answer the first question with regard to hospitalizations, from the latest data I have across the city systems, we have 58 people hospitalized with confirmed COVID-19 in the hospital systems across San Francisco. Again, that number could rapidly change. It's too early for me to speculate around whether we are succeeding in flattening the curve.
Next question is from Christian Kaftan, KTVU. May I ask if San Francisco is coordinating San Francisco or Dr. Colfax are coordinating with any other Bay Area counties in the city, counties, cities, or the state of California on how long to extend the stay-at-home order?
Yes, so certainly I am in regular contact with health directors across the region, as well as direct contact with state health leaders in the response to this pandemic. Coordination around the health order, the initial order, as you know, was done collectively across the region. That has a very important effect. No one jurisdiction will be as effective in doing this type of stay-at-home order. It's far more effective from a regional approach. The order that will be released tomorrow will be another regional approach going forward. It is essential that we collaborate, share information, and act together to reduce this pandemic spread.
And the final question is from Dominic Fracassa of the Chronicle. With respect to the extended shelter-in-place order, will any activities that are currently permitted, like housing construction, be prohibited under the extended order?
So the order will be released tomorrow, and those details will follow.
Thank you. That concludes our press conference. Thank you.